Okay, so now we're going to look at passive range of motion for the hip joint. We're going to start off with flexion, and what I like to do is to get them to actively move the leg first of all, and then add the passive component afterwards. So if I ask you to flex your hip for me, so bend your hip up as far as you comfortably can go. You're looking at range, you're looking at symptom reproduction, you're looking at any sort of noticeable compensations, leg flaring out or lumbar spine flexing, and then come back off. Now let me take the weight of the leg, and I'm just going to explore into that range as well. Flexion again, we're looking for approximately 120 degrees. Most important thing is to compare to opposite side. In this position it's quite nice. If you were to get symptom reproduction, you could do a couple of things. You can take the leg here, you can add a little bit of traction to the joint, and you can bring it up into that same range, see if it changes the symptoms, and also see if you get any more movement. Throughout this test you're asking the patient for feedback. Are they getting any reduction in symptoms? Does it feel easier for the movement to occur? So that would be a caudal traction, and what we could also do is do a lateral traction with the Mulligan's belt, but we'll go through that in detail when we look at treatments. Yeah. So if we go to the next movement, which is Deduction Abduction, I'm going to do this one completely passive. So I'm going to hold your leg, I'm going to stabilise at the hip, and I'm just going to bring your hip out here. Again, key point here is to compare the opposite side, but on average you're looking for about 40-45 degrees, which we're achieving there. Good. For adduction, I'm going to show you on the left leg for the purposes of the video. We can take this side over. I'm going to come across to here, and again I'm going to stabilise the opposite hip, and I'm just going to bring that across. Adduction a little bit less, looking at around 25-30 degrees passively. But again, most important thing is comparing the other side. If we're looking at internal rotation, I bring the client's leg up to 90 degrees, hold that position, and then just bring it across. Looking for about 35 degrees. And then just the opposite way for external rotation. 90 degree at the hip, 90 degree at the knee. Good, okay. Last one we're going to look at, extension. So I'm going to get you to go onto your front for me. So with extension, it's another movement that I like to get the patient to do actively before I test passively. So I'm going to ask you, PJ, to just lift this left leg for me as far as you can. And a few different things I look at when I get them in this position to do this movement, and relax again and repeat again for me. So as we were saying in the active range of motion testing in standing, you really want to concentrate on the lumbar spine area and see if there's any significant hinging going on in there. Just with the finger position in hamstrings and glutes, gives you a rough idea what his preferred activation pattern is as well. And quite often you see people very dominant in the hamstrings or very inactive in the glutes. It just gives you a rough idea. And then from here, to test the passive range, I'm just going to bring the knee up to this position, and I'm going to take that weight in my right hand. I'm going to stabilise his pelvis, and I'm just going to bring him up here. Again, I'm feeling the end feel, symptom reproduction, getting the subjective feedback from the client as you do this movement. Average is about 20 degrees, something like that. And again, you're going to be comparing it to the opposite side.